Thank you, everybody, for being here tonight. We're so excited to be starting our perinatal mental health discussion tonight. And of course, just wanted to remind everyone that this is coming together through the San Antonio Family Support Collective, which is a group of local health and wellness women coming together to share information to everybody in this current time that we're all experiencing. And so today, Whitney and myself are coming together to discuss all things perinatal mental health. So thank you for joining us, and we're so excited to have you here. And we're going to go ahead and get started by introducing ourselves. So here we go. Oh, wait. There we go.
Yay! Hello, my name is Whitni Toson, and I'm a licensed professional counselor. I am the owner of Alamo Ranch Counseling and Wellness. It's a private practice located in Alamo Ranch in San Antonio, Texas. I've been trained in perinatal mood and anxiety disorders through Postpartum Support International, and I am a mother of a 19-month-old toddler, little boy. The reason why I'm so passionate about this topic is because I also went through my own postpartum journey with postpartum anxiety. That's me.
Thank you for that. And then a little bit about myself. My name is Esmeralda Cardenas. I'm also a licensed professional counselor. I'm the owner of Pillars of Life Counseling. I'm a bilingual counselor, and I also have been trained in perinatal mood and anxiety disorders through PSI. I have two boys, ages 6 and 9. So lots of online school going on today or in this time. And then I also am a survivor of postpartum anxiety and depression with both of my boys. So another reason why I'm also very passionate about this topic, and we're just really glad that we're able to share this discussion today. So one thing that as we move on in our discussion that we want everybody listening to keep in mind, because there's a lot of information we're going to share as a parent or maybe expecting parent. We want you to remember that you're still the best parent for your child and that you're doing the best that you can do right now. And most importantly, you probably hear this all the time, but you're not alone. And I think neither Whitney or I are probably going to get tired of saying that, because as moms that experience this, we know how important it is to know that we're not alone in this struggle, and that there's definitely support out there. So as you're listening, just remember to have grace and compassion with yourself wherever you are. So another thing, this is just going to be our outline of what we're going to discuss today. So with perinatal mental health, we're going to be going through the definition of what that means. We're kind of throwing around this term, and sometimes it's not necessarily that we know exactly what it entails. So we're going to go through what it means, along with other information that goes with it. We're going to discuss treatment options, and then we are also going to talk about some tips, some helpful tools that you can incorporate right now, whether you're in the expecting period or in the postpartum period.
All right, so let's jump in. So what is it? Perinatal mood and anxiety disorders are a group of mental health conditions that are known for causing significant distress in an individual's thoughts or emotions or feelings. It can occur during pregnancy and the postpartum period up to 12 months. So when we say a group of mental health conditions, you have postpartum depression, which is most known by most people. You also have postpartum anxiety. You have postpartum post-traumatic stress disorder. You have postpartum OCD, postpartum psychosis, and postpartum bipolar disorder. So you could have one and you may not experience the others, or you may experience postpartum depression and postpartum anxiety. So it's a group of conditions. And perinatal itself means the time surrounding birth. So anytime from conception up to a year postpartum is when we look at assessing to see if it's a perinatal mood anxiety disorder. So how prevalent is it? So research shows that 15 to 20% of mothers experience symptoms of perinatal mood and anxiety disorders. So that is 1 in 5 to 1 in 7 moms. And this is just the moms that report it are going to have those symptoms or become diagnosed with that. And then 10% of fathers experience depression and anxiety as well. So that's 1 in 10 fathers will have symptoms. Usually after the baby's born, they probably go through that. And why is it important during this time? So having additional support after having a new baby has been shown to decrease the mental load that most new parents have. So in general, becoming a new parent itself for your first time or the second time, having a new baby can be very stressful. And so when you have that additional support, it does take off some of those stressors or triggers that can cause some of these postpartum mental health conditions. With the current pandemic, many parents are isolated from their support groups, which adds additional strain on the household. The current situation can be a trigger for new fears and worries, hypervigilance, and increased feelings of isolation. So with COVID-19 going on, that's its trigger in itself. So you might notice that most people in the world right now have some level of increased anxiety. So if you can imagine being a new parent and having an infant that you want to protect and not having support because maybe you don't want your in-laws to come into the home because you're fearful they could transfer the virus. You might just be hyper vigilant. So it's why it's important for us to talk about this right now, just because it's a very triggering time.
Yes, definitely.
Did you want to add anything?
No, I think that's all great. And I think if anything, it's going to be important that we pay attention to what are some potential events, signs, and symptoms that we may see. A lot of the symptoms that we're going to talk about right now are actually applicable even if we weren't in this current situation. So just take that into consideration. But I also want to stress that being in the current situation, some of these symptoms may actually just be exacerbated, right? They might increase even more than you would experience them maybe without the current pandemic that we're going through. So I want to discuss some risk factors first, because these risk factors can really help us to just be aware beforehand, before we're actually experiencing any symptoms themselves. So even if you're maybe in the stage of wanting to have a baby, or you're in the early stages of pregnancy, then it's important to also consider, are there potential risk factors that could contribute to the potential development of one of these issues during my pregnancy or postpartum. So some of them are going to be if we have a history of trauma, if we have a history of mental health illness in our personal life or within our family, if there's any medical health issues, things like thyroid issues can contribute to this. Miscarriage or infant loss can also trigger a lot of different emotions and different thoughts during the expecting period and postpartum period. And some other risk factors are societal expectations, being aware of what are some of these expectations that we feel we have to meet, that we hear from society, and how do these add pressure to our life. Also cultural expectations, just paying attention to culturally, what are the messages that we receive when we come from cultural backgrounds where maybe there's a lot of rigid rigid information in terms of, what makes you a real mom, being a strong mom, all of those things. will have a significant sometimes effect on the way that we adjust to our pregnancy and the postpartum period. Things like perfectionism, so having a pattern of perfectionism in our life can also contribute as a risk factor. A lack of support, unplanned or unwanted pregnancy as well can really trigger a lot of these symptoms. So just pay attention to some of those things. Then we can move on to understanding what are some of the most common, maybe emotional symptoms and social symptoms that we may see, and signs to pay attention to. So for emotional symptoms, we have you've heard of this, maybe feeling sad or depressed. We want to point out too that the baby blues only occur for about 2 weeks after giving birth. So if the sadness and the feeling of depression continues past those 2 weeks, then that's when that's a sign that it's important to seek the help. If you experience irritability or outbursts of anger to the point of rage, which can also be common postpartum, then it's also important to address that. If you experience anxiousness or fear, which can also come with maybe some thoughts that we might be afraid of having during pregnancy, like pay attention to what these fears are and what are those potential thoughts that you're replaying in your mind. Not feeling enough as a mother, not feeling like you're doing as much as other people or other moms, the guilt and or the shame, which is a really, really big one for us moms. And especially also, I think we see this one a lot more commonly with working moms too, when you're deciding if you want to work or if you're going to stay home. Honestly, either or can bring a lot of guilt and shame depending on your own experience and your own beliefs. Also worry of hurting the baby. Difficulty bonding with the baby, feeling a loss of control. When also we experience a birth trauma, a loss of control can be a significant factor in that. And then, of course, if there's changes in the birth plan, you can experience feelings of grief and loss of control together. So those are things to pay attention to as emotional symptoms or signs that can help you to understand if maybe you need some additional support. Then we have social symptoms, and social symptoms are going to include things like socially withdrawing. So right now we hear this term of socially distancing ourselves, and I don't know how many of you guys have heard maybe a twist, a reframing to that, which is like to physically distance rather than to socially distance. So if, for example, you're watching this and you're in the postpartum stage and you're feeling maybe isolated or you're feeling like you don't have connection with people, to hear social distancing, you might actually push yourself into not connecting with people. But let's differentiate between that and remember that it's physically distancing. Socially, we can still connect. We can still reach out to people. Video calls, whatever we may need to do to stay in contact, maybe via things like Zoom or FaceTime. Also, social symptoms that can contribute are when we feel overwhelmed with those cultural societal expectations that we talked about as risk factors. Feeling a loss of self. You as a mother are being born as well. And I think that, I don't know about you, Whitney, but when I had my second child, I still felt like I was reborning. I was giving birth to another version of myself because there was so much more to come then. You know, it doesn't matter if it's just one child or if it's 2 or 3, we're all going to go through those changes. And so we're constantly, maybe potentially going to feel a loss of self and trying to redefine who we are again. Feeling a loss of friends, that can be another societal or social symptom that we can experience. Just changes in our interactions with people that were close to us and maybe we're not close anymore. And then the big one, comparison. I think right now, especially during this pandemic, we can potentially find ourselves going through social media and noticing how other moms are handling this pandemic, or how other moms are keeping their kids entertained, or we compare ourselves potentially to what is around us, and we have to be really careful about that, because that can really trigger a lot of unhealthy patterns and just affect our well-being in general. Did you want to add anything to this one, Whitney?
No, I just want to make a comment. When you talked about the social symptoms,
Yeah.
I agree. It makes me think that when you become a mom, first, second, third time, you probably are going through, well, at least for me, it could be a little grieving process when you feel like
Yes.
you're not who you are. It's a change, it's a big change, and it's a lot of responsibility. And you have some priorities that come up that, you have more things to prioritize, that maybe you have to put some things on the back burner. So I definitely think there could be a grieving process along with it.
Yes, absolutely.
All right. So seeking help. So when should we seek help? So symptoms can develop, as we talked about earlier, during pregnancy or the postpartum period. If you notice any changes in your daily behavior, mood, thinking habits, or relationships that are causing you distress, do not hesitate to seek help. So basically, if your thinking habits become to the point where maybe you're starting to have emotional responses where you feel uncomfortable, you feel like you can't manage your thoughts, that's a good sign. And if you notice changes in your behaviors that's causing distress, well, I'm sleeping in, I'm late to work, you just notice that certain areas of your life are starting to be impacted by it, that's a good sign to seek help. Sometimes our close circle may notice some things before we notice, and that may be another indicator that, okay, maybe I should talk to someone. So how? Communicating your symptoms to your OBGYN, doula, midwife, or family or friend, that's one way. You can also seek help from a therapist or find a support group to navigate the changes. So basically, being an advocate for yourself, just sometimes just saying, hey, I'm struggling, can open a door for someone to come in and kind of assist you. And then how long? So perinatal mood and anxiety disorders are treatable, and each individual treatment plan may be different. Basically, sometimes some people's journey may take a little longer, and some people's journey may be a little shorter. So we couldn't really put, a year, 6 months. It really depends on when you decide to get help, and also the process of going through what you need to process if you go through therapy. Seeking help is not a sign of weakness or being a bad mother. The sooner you get the support you need, the better for you, the baby, and your family. So you don't have to suffer or prolong things, but the sooner is definitely the better to get help.
Yes, and I would like to add that if anybody watching right now is interested in knowing about support groups, we definitely, Whitney or myself, can connect you to online support groups that are going on right now, so that you can connect with other moms that are potentially, going through something similar to what you are going through. So definitely utilize us as a resource as well. And don't hesitate to reach out and let us know if you need that information.
Thank you. So the treatment. I just want to say something real quick.
Yeah. You want me to go back?
Yeah, you can go back. Basically, I agree with you. I agree that having that support, what I found when I was doing the support groups was that a lot of moms, what comes up is, I'm not alone, I'm not crazy. So it just tells me there's a lot of shame around, struggle, going through this journey.
Mm-hmm.
So I just wanted to put that out there. Like you said earlier, you're not alone, and it's okay, to need to get help. It's okay. And you're not a bad mom if you are going through this. Okay, that's all. Okay, so treatment options. So prevention. While no one is immune to perinatal mood and anxiety disorders, there are some preventive measures you can take. Childbirth classes that incorporate mental health information, breastfeeding courses if you wish to breastfeed, establishing a support system, stay in tune with how you're feeling, and communicating your needs. So the good thing about childbirth classes, I know you said yours didn't talk about postpartum or perinatal mood and anxiety disorders. Right. The one I went through, it did speak about it. So it also gives you insight about labor, the labor process, the delivery process. Because personally, I had a lot of anxiety about, how is this going to happen, So just kind of becoming educated on things. Yes. That is a good method. We can't say you will not develop any symptoms after you have your child or during pregnancy, but education is a big part of, being able to recognize signs and symptoms. Yeah. When I say breastfeeding courses, I find that many moms do wish to breastfeed, and that when they aren't able to, for whatever reason, that also creates shame or depression or anxiety surrounding that in general. I do know breastfeeding research has shown that is one helpful way to reduce symptoms is to breastfeed, but that's not always the case for everybody, because some moms that don't want to breastfeed, if they do because they feel pressure, you might notice that they start to feel depressed because it's something they don't want to do. Mm-hmm. Okay. And then management. Therapy is a great option individually. If you start to struggle in your relationship, I know John Gottman, he said that marriage declines. I want to say marriage or relationship satisfaction declines about 50% after you have that first child. Mm. So I would think a good portion of couples are going to go through a struggle after they have that first child. The support groups, medication management, if that is an option for you, and having a support system and practicing proper sleep hygiene. Sometimes just being sleep deprived will trigger mental health symptoms. So maybe not having caffeine after 2 p.m. or turning off the screens at least an hour before bedtime could be helpful. And then support and alternative approaches. Support from your doula, if you have one, midwife, acupuncture, chiropractic care, dietary and herbal supplements, massages. I was a big massage. Even when I was pregnant, I had to get my massages. Like,
they're good.
Yoga's a good one, omega-3s and vitamin D, exercise and proper nutrition. Mm-hmm. So I know with chiropractic care and a lot of body work in general is going to be helpful, because when you think about stress and anxiety and depression, a lot of times it goes to our shoulders, our necks, it goes to our digestive system. It's just, right. It's all connected. So just looking at some alternative approaches, even if, especially if you're not one that wants to take medications, that's an option. But, if you do need medication, I definitely say, seek help and weigh out your options, because you shouldn't feel shame if you have to take medication. So those are some of the treatment options.
Yes. And we have Blanche. She said massages are the best.
Oh, yeah.
Awesome. Thank you for that. And I will also say that whenever we share this video on the Facebook page, we'll definitely tag some of the San Antonio Family Support Collective providers that can support with these alternative approaches as well, so that you have access to those. Oh, I did something to my screen. Okay, so thank you, Whitney, for sharing that. We know that sometimes that's, maybe a lot of information to take in, but definitely, go back to it as much as you can and see how any of that applies to you. One thing that I maybe wanted to add to that is that going to therapy or seeking alternative approaches doesn't have to happen until you're experiencing symptoms. You can be proactive in preventing. So that prevention aspect is so important. And so sometimes even just going to therapy to process through what you're going through in your pregnancy or early stages of postpartum can significantly decrease the severity of any potential anxiety or depression that may be developing. So I know that sometimes with mental health, we might feel like, oh, well, that's only for people that are struggling really bad, but it really is. If I always like to think of it this way, if we have a brain, then we have a mental health to take care of. And so it's never too early, and it's, to start to incorporate that and use it as much as we can. So to jump into another topic, we wanted to address some tips for supporting partners, supporting persons for somebody that's expecting or somebody that is in the postpartum period. So if you're watching this and you are the parent that's expecting and you're in the postpartum stage, then you might say, well, I need so-and-so to hear this. So you're welcome to share this information with them. And if you're a supporting person listening to this, then these are just a few things that we are recommending that we can incorporate. So the first one is going to be just doing some regular check-ins with the person that you love that is expecting or in the postpartum period. And what does that mean? That's going to be more reaching out and asking very specific questions about how they're adjusting to parenthood. This is really important because we naturally just go to, how are you doing? Which is completely okay. It's just natural for us to go into that default question. I know that I often find myself doing that. And so it's okay if we ask that question and then follow up with, well, tell me more about, how is the sleep going? And asking more specific details about what the postpartum changes and transitions bring. Specifically right now with the virus that we're dealing with, asking expecting parents and in the postpartum stage, like, how are they doing? Are they having any particular fears, any particular anxiousness or stressors about what's currently happening? I know that social media, we have so much access to what could be happening in another state or in another country, about even not having their support person with them in their birthing room. And that can really trigger a lot of anxiety for a lot of moms. So even asking specific questions pertaining to that. And I'm going to jump into the provide support, not advice, because I kind of thought these go hand in hand. So when you're asking or checking in with your loved ones, it's provide that support, right? The support means that we're going to listen and that we're going to be attentive to their needs, rather than saying, for example, well, don't be worried about that, it won't happen to you. Or, because that can, in a sense, minimize their emotional experience about the situation and the stressors that they're going through. So advice is really only necessary when the parent themselves is asking for it. And if they're coming to you to give you that advice, to ask for that advice, then it's okay for us to say, this is what I have tried. So making sure that in this current situation, we ask very open-ended questions, that we ask very specific questions, especially if you have a close relationship with the expecting parent or the parent in that postpartum stage. it's easier then to ask those questions more directly. So definitely, if you ask and you don't get a direct answer, that's okay, but at least it'll leave that mom kind of thinking about it, and maybe knowing that you had interest in them, and maybe they'll come back to you and share more openly how they're feeling. Then the other thing would be, paying attention to any changes in behavior that you may notice. Maybe they're socially withdrawing more. Maybe there's an increase in irritability. You see that they're having a difficult time bonding with the baby, or expressing things like, I can't do this, or thinking about a lot of what ifs. Or, maybe I'm not handling this like so-and-so. Paying attention to some of those things that they communicate will really let you know if maybe they're struggling with something. And when you see those behaviors or notice those thinking patterns, then you can, come from a place of love and care by saying, maybe I'm worried about how this may be affecting you. I wanted to check in with you to see how I can support you during this time, or is something going on? And so it's okay to come from a place of love and care, rather than saying like, why are you saying that? Because then that would completely, shut that person down. So those are just some tips that you can incorporate in the relationship, or in the loved ones you have right now that are maybe in that expecting or postpartum period. So now we're going to jump into some quick tools and tips for parenthood that we can utilize. And as we share some of this, we want you to remember that anything new that we incorporate into our life requires consistency and trial and error until we find what works for us. So just give it time, give it consistency to see if it works. So one of the first ones that we wanted to discuss today is what we want you to remember is nests. So this can be during pregnancy or postpartum, and this pertains to self-care. This one is going to be asking yourself, the N represents nutrition, and nutrition is going to be, have I just had a meal today, period. We're not even at this point going to worry about is it nutritious, right? We're just going to focus on, have I eaten? Have I drank water? Other than my child's snacks or whatever's left over. It's providing ourselves with the food that we need for our body to be nourished. Sometimes we just need to take that one step, just feeding ourselves, and then later we can focus on, am I feeding myself the most nutritious meal? Because sometimes we can stress about, just a nutritious meal and then just not eat at all. So checking in and saying, have I eaten? So that would be the N for nutrition. E would be exercise, but I like to change it to movement because generally exercise comes with this feeling that it needs to be for long periods of time and very rigorous exercise. And so when you think of movement paired with exercise, think about just anything that can get you to move around for more than like 10-15 minutes, or about 10 to 15 minutes. So anything from, I used to just play music in my living room, grab my newborn baby and just dance around with my baby to just get some moving around even when I didn't want to. So that can really just bring some oxytocin into our body, get some positive hormones, healthy hormones flowing. And then we have the S for sleep or rest. And this one's important because sometimes, we're sometimes told, well, sleep when the baby sleeps. You don't have to sleep when the baby sleeps, but maybe rest, right? Think about ways that you can rest. Maybe think of saying, okay, I'm going to do the dishes for 10 minutes and then I'm going to rest for 30, right? And so allowing yourself, because I get it, we want to get things done with the baby sleeping. We want to get as much as we can, But sometimes it's okay to it's good to be in tune with ourselves and say, I need rest, and figuring out how I can do that. T is for time for yourself, which as moms, we have a really hard time doing as well. But checking in with your support person and saying, I just need 5 minutes to shower by myself, or I need 10 minutes to just be in the quiet and need some time away. It's okay to ask for that time that you need to step away. And then, of course, S is for support. So making sure that we know that every single mom needs and deserves the support to be heard, to be loved, to be cared for. And so looking for people that are going to provide you that support. If you're finding yourself in relationships where you're constantly not feeling supported, even judged or beaten down by something, it's okay to take distance from those relationships until you can find a better place to be able to be in them, or better able to communicate to them that that's not serving you. So this is nests, and I will also add all of the information to this on the video, because I forgot to add it here.
All right. So the one I want to talk about is identifying your values. So I really love talking about values with my clients. I love it with myself because it really helps you kind of put your priorities in perspective. Mm-hmm. So what I put was knowing what your top priorities are at the moment will help you think of ways to commit to those values. I don't really like the example I put on the slide. I'll read about it, but then I'm going to share another one with you. So if you value alone time, make sure to coordinate with your partner to ensure you have at least 30 minutes of alone time. So I want to talk about another value because I think this is one many people probably do value. I'm going to use the example of valuing a family. So if family is one of your top 3 values, but you're working all the time or you're away from your family, you may notice those uncomfortable emotions and you're just not happy. But if you find time to get closer to those values, meaning quality time, or maybe I can watch a show for 30 minutes with my family, or maybe I can put my kids to bed, whatever it is to get you closer, you identify what that action is, and then you commit to it. So if family time is important to me and I say, okay, I want to make sure on Saturdays that we go on a walk for 30 minutes and just talk about life together. And I'm going to commit to that. So you will find the more you commit and take action, you're showing that, I am able to live in those values. Mm-hmm. So that's mine on values. One thing that I also want to talk about that you kind of mentioned is compassion, just having self-compassion and knowing that, throughout this process, as being a parent, you're going to make mistakes. I don't know any perfect parent, but just allowing yourself to make those mistakes and learn from them and forgiving yourself. I think that's going to be a big help.
Yes. Thank you for that.
Uh-huh.
It's so true. And definitely those values and practicing those nests can also go hand in hand, right? If we value rest or if we value support, then that can also marry each other.
Definitely.
And then, of course, we have validating. So I don't know how many of you guys have seen maybe, what do you call those, like infographics or those images that kind of go around on social media. And there's a really nice one with a circle. It's like a circle, and it talks about what are things that you can control and what is outside of your control. And I love the image. It contains a lot of wonderful things. And it's all of it is in relation, of course, to COVID right now. So I was thinking about it, and I really was thinking it's really important to be able to understand what is outside of our control and what is within our control. But as an expecting mom, or as a new mom right now, maybe going through the process of negotiating those things can be really frustrating. And I think that it's completely okay for you to feel those emotions. And so validating how you feel in the current situation. So, not having the support from family during your birth, or not having potentially the baby shower that you were expecting to have. There's a lot of things that are being limited for a lot of moms right now. And so it's okay to tell yourself that it's okay, to validate where these emotions are coming from, to say, this makes me angry, and it makes me angry because. And it's okay that it makes me angry because I'm maybe grieving this. This is a big change for me. And so once we're able to validate and accept and maybe just sit in those emotions, then we're able to transition our mind into the aspect of, what then can I control right now? What can I provide to my environment right now to allow myself to enjoy this pregnancy the most that I can, or enjoy my baby in this current time? When we are dismissing or avoiding these emotions, then we may experience these emotions heightening even more, because we can only brush things under the rug for so long. And so I think that validating aspect is going to be so important. And, if you have maybe a supporting person around you that you feel maybe isn't validating your emotions, it's letting them know that that is a need you have in the current moment, and communicating that can also be very healthy and very good for everyone all around. So we'll did you want to add anything to that one?
I love this one.
Yeah.
I just want to say, I know a lot of times people in general will say, well, think positive. And this just lets you know that, it's okay not to think positive all the time. And it's
Right.
okay to be in that moment with those feelings, because we have them for a reason. And like you said, suppressing them can cause bigger problems for us. So I really like that you put that out there. And then, as a support partner, being able to validate that, maybe my spouse or my partner is grieving, and you may be grieving as well, because maybe you did want your in-laws or your parents to come to the hospital. And, so I like that.
Yes. And it's definitely hard to practice validating sometimes. And, I think that sometimes it's the only thing we can just focus on, right? To try to be more gentle with ourselves, to be more compassionate, like you said. So I really love this quote from Megan Hallman, I believe, that says, "Be gentle on yourself, mama. You have been reborn too," which goes with the concept of matrescence. If you haven't heard about it, you can find amazing, even TED Talks on matrescence that really talks about being born as parents, and almost going through something as similar as what teenagers go whenever we become moms. So this is something that we want you to remember as you go through this. It's remember to just be gentle. We keep saying that, probably we've said that since the beginning, because in our work with moms, we see how valuable this is and how important it is to practice it. So definitely remember to be gentle on yourself.
All right. So we want to thank you all for watching this presentation with us. We know it's a lot of information, and it isn't all the information that's out there. Perinatal mood and anxiety disorders is a very wide area to explore in the mental health realm. So this is a very brief dive into it. We also want to say, go to the San Antonio Family Support Collective page on Facebook. There will be more videos to support the families in San Antonio and surrounding areas during this time. So
yes.
Did anyone give us any questions, Esmeralda?
We don't have any questions on the chat. So I don't know if anybody that's watching has any questions. If you want to unmute yourself, we have a couple of minutes to dive into. If not, we can probably proceed to the last slide, but we want to definitely give time for any.
And then maybe if they are watching this after we recorded it, they can always find us on social media or ask the questions on the collectives page, and then maybe we can answer it later.
Yes, definitely, definitely. All right, so I don't think we have any more questions. If you want to connect with us, this is my information with my email. We also have my phone number is on there, my office address. I'm not currently in the office, because of all of this. So telehealth is definitely available. My website and social media as well. And then let's see. Let me move to the next one so Whitney can share with you.
Hey, it's me. So I'm also not doing any face-to-face therapy at this time. So I am providing telehealth services. If anyone's interested, my social media is at the bottom if you want to follow me, or if you want to shoot me an email or text, that's my phone number right there.
Stay tuned for that. Thank you so much. We appreciate your time.
Thank you.